Welcome, Dr. Rajita. Please.
Thank you, sir. Thank you, sir. Good evening, everyone, and a warm welcome to all homeopathic students and doctors. This is our 1964th day of uninterrupted daily webinar of IFPH, International Forum for Promoting Homeopathy. And our today's guest is Dr. Amrutha Manoharan. Very good evening, ma'am. And she is MD Homeopathy, Diploma in Yoga, Diploma in Naturopathy, Diploma in Clinical Cosmetology, PG Diploma in Hospital Administration. She is former assistant professor in White Memorial HMC, former lecturer in Nightingale College of Nursing, former senior research fellow NHRIMH Kottayam. Her topic is exploring the urolithic action of hydrangea for renal calculi. Uh, Hello, ma'am. You can continue. You can start your presentation.
Thank you so much, madam. So, good evening, all.
Okay, ma'am. You can continue.
So, today we are going to discuss about the urolithic action, that is, exploring the urolithic action of hydrangea for renal calculi. So, renal calculi is commonly known as kidney stone or urolithiasis. So, this is the main anatomy of the kidney. That is, it has a outer cortex and inner medulla, and the renal calculi can occur any part of the kidney or the urinary tract. Sometimes it may occur on the inner side of the kidney, or sometimes it may occur on the bladder, or sometimes it may seen on the in the papillae. It may sometimes occur on the major or minor papillae and in between. So, renal calculi or urolithiasis constitute one of the most prevailing urinary disorders, and it is characterized by the crystal deposition, mainly calcium oxalate and uric acid and cystine crystals are seen within the renal tubules. So it is one of the most important urinary condition, that is your system most commonly affecting urinary tract disorder is the renal calculi. Next, the oxidative stress and urine supersaturation, low urine citrate and tubular injury. These all factors which will trigger the formation of calculus. The condition is often associated with severe pain, urinary disturbance, and recurrent episodes if the condition is present. So the most common symptom is annoying. There will be severe pain will be there associated with the urinary disturbance. There will be frequent urging to urination, pain during urination, and blood in urine. And there will be, if the condition is not properly treated, it will lead to the recurrence of the condition. Along with the conventional approaches, homeopathy has a holistic and individualistic method which will aim to remove the stone and also reduce the symptoms of the patient with renal calculi and also preventing the further recurrence. So, what are the factors which will lead to the formation of renal calculi? So, first one is a decreased amount of water intake. So, when we are not drinking adequately about 2.5 to 3 liters of water per day, which will be one of the triggering factor for renal stone formation. Next one is hot climate. When you are traveling or when you are residing in a extremely hot climate, and also when you are dehydrated. Next, food items rich in oxalates, animal proteins, and salts, such as the excess of the oxalate content in the body and excess of the animal products, which will also trigger the formation of renal calculi. Then some metabolic disorders like hypercalciuria and hyperuricemia, and also disease known as hyperparathyroidism, which is commonly caused the disease of bone stones, abdominal groans, and psychic wounds. So this disorder has increased amount of calcium production in the body, which in turn deposit on the major part of the body, and it will also act as a trigger or the causative agent for renal calculi. Next one is urinary tract infections. frequent urinary tract infection, then family history, and also a sedentary life. So the most important etiology factors is decreased water intake, living in hot climate, then increase taking food items which are rich in oxalate, animal protein, salts, and also some metabolic disorders like hypercalciuria and hyperuricemia. Next, urinary tract infection and also family history along with a sedentary lifestyle. So these are the conditions, and also in few researches are now available that shows the family history. That is, the genetic also plays in a important role behind this kidney stone. So next is the types of calculi. So the main types are calcium stones, uric acid stones, struvite stones, and cystine stones. So as I mentioned just now, it is a rare genetic condition. Okay. When the rare genetic condition occurs, the type of stone is the cystic stone. And during infections, that is when a person undergo frequent urinary tract infection, in that time, the type of stone is struvite stone. Next, when there occurs an increased amount of uric acid in the body, it lead to uric acid stone. And calcium oxalate stone and all the calcium phosphate stone, it is the most common types. So based on the pathology, the types of stones also varied, and based on the pathology, our types of treatment is also varied. So suppose if the patient having a uric acid diathesis also, our remedy will change like that. When there is a history of frequent urinary infection, our remedy will change like that. Okay. Then the types of renal calculate include calcium stones, uric acid stones, struvite stones, and cystine stones. So these are the different types of stones. So this is the picture of the cystine stone. This is the picture of the cystine stone, and this is the picture of the calcium stone, and this is the picture of uric acid stone, and this is the picture of struvite stone. So the signs and symptoms. The important signs and symptoms include there will be severe colicky pain, which will be radiated from the loin to the groin, and the pain will be aggravated by movement and during maturation. There is increased frequency of urination, and blood in urine will be seen. The colicky pain will be there. The pain will be radiating from the loin to the groin, and sometimes the pain will be aggravated during movement, and the patient will frequently complain of a burning maturation along with the increased frequency and urgency of urination. You can see the same symptoms of frequency and urgency of urination condition known as BPH. Okay, BPH, there occurs increased frequency and urgency of urination, mainly affect the old age male of about 60 plus. Then hematuria. Next, nausea and vomiting. In some case, it may present with the nausea and vomiting. The urine will be scanty or interrupted urine will be there, and there will be restlessness will also be there. If infection is present, it will lead to fever and chills. So the main symptoms include fever, stomach pain. The pain will be radiated from the loin to the groin, then vomiting, dizziness, blood and urine will be there, and back pain will be there. So the major complications include if the condition is not properly being treated. Okay, if the condition is not properly being treated, it will lead to recurrent urinary infection, obstruction of urine flow, then hydronephrosis. The ultimate complication is hydronephrosis, then renal damage or renal failure, then there will be sepsis in the region of kidney. So mainly the obstruction of the renal tract, retention of urine, hydroureter or hydronephrosis, then destruction of the kidney and the infection. So let's brush up what we have seen today. So renal calculi is also known as kidney stone or urolithiasis, and the main pathology behind this deposition of calcium oxalate crystals, and the main cause are due to over oxidative stress or urine supersaturation and reduced citrate along with the tubular injury. So the condition will be presented with the severe pain and urinary disturbance. The main reason behind this is there is a decreased water intake, hot climate, diet rich in oxalates and animal protein, and some metabolic disorders like hypercalciuria, hypercalcemia, then frequent urinary tract infection, family history, and a sedentary life. So based on the types of calculate, it is divided into calcium oxalate stone, which is the most common. Calcium oxalate and calcium phosphate, which is the most common form. Next one is the uric acid stone. Next one is the struvite stone. Struvite stone mainly occurs due to urinary infections, recurrent urinary infection. Then cystine stone, which is a rare and a genetic condition. So the signs and symptoms, there will be severe colicky pain radiating from the loin to the groin, and the pain will be aggravated by movement and by maturation. There is increased frequency and urgency of urination along with the hematuria. Other symptoms include nausea and vomiting, scanty or interrupted urine, restlessness, and also fever and chills if infection is present. The most important complication, if untreated, it may lead to urinary infection, urine or outflow obstruction, hydroureter, hydronephrosis. In severe case, it may lead to renal damage. So the main investigation. Include urine routine, that is urine RE and urine microscopy. That will check for the pH, and in case of blood test, we can check for serum calcium, uric acid, creatinine, and urea. Mainly we check for uric acid to find where it is a uric acid stone or like that. And also check for the creatinine and urea for the proper, to check whether the kidneys are functioning normally. Next is imaging studies. It include USG KUB, and also X-ray KUB. Along with, in some cases, we cannot properly find the reason behind this. So in that cases, we can go for non-contrast CT. Then the investigation, I will tell on more. The investigation include mainly the laboratory investigation, and the urine routine and urine microscopy, which include RBC, crystals, and infection. Then check for the urine pH, and also blood test. It includes the serum calcium, uric acid, creatinine, and urea. The imaging studies, it include USG of KUB, kidney urinary bladder, and then X-ray KUB and non-contrast CT scan, which is one of the gold standard finding in case of investigation in renal calculi. Then prevention. So how can we prevent such renal stone? So prevention is essential. First one is drinking adequate amount of water, about 2.5 to 3 liters of water. Drinking a balanced diet and avoid excessive oxalate, such as tea, spinach, not to be avoided, and removing the urine in a timely basis, and also regular follow-up. So first, management of calculi can be divided into three. First one is the conventional management. So the conventional management include adequate hydration, analgesic antispasmodic medicines, and medical expulsive therapy, and ESWL, that is the extracorporeal short wave lithotripsy, then ureteroscopy or surgical intervention in complicated cases. So this is the conventional or the traditional management. But in most of the cases, even though after doing ESWL or lithotripsy like that, there is still tendency to further formation of renal calculi in the same patient. Okay. So homeopathy can do wonders in that cases. So conventional methods include additional adequate hydration, then analgesic and antispasmodic medicine, along with the medical expulsive therapy and ESWL, along with ureteroscopy or surgical intervention. Then dietary management include increased fluid intake, reduce sodium, and limit animal protein, and also protein and other food items which contain increased calcium content, mainly the spinach, nuts, and the tea. Then avoid oxalate-rich foods like spinach, nuts, and chocolate. Increased intake of fruits and vegetables, and avoid excess caffeine and carbonated drinks. Next is homeopathic therapeutics. There are plenty of medicines in homeopathy available for renal calculi. So first one is Berberis vulgaris. Berberis vulgaris, the pain is the typical what we study during our UGs, BSNL pain, that is burning, soreness, numbness, and lameness will be there in Berberis. There is sharp shooting pain from the kidney radiating to the bladder or urethra, pain extending to thighs. There is bubbling sensation in the renal region, and left side stones are mainly in this Berberis. We can see left side renal calculi, and the first choice with the colicky pain. Next one is lycopodium. Lycopodium is right side affection. There is red sand in urine, and pain worse before urination is present, associated with the bloating and the digestive disturbance are present. Next, hydrangea. Hydrangea is also known as the stone breaker, today's most important medicine. So there is a white or yellow sandy deposit in the urine and frequent urging to urinate, especially for stones in the ureter or bladder. Next, cantharis. Cantharis, there is intense burning pain before, during, and after maturation. Okay, on the three phases, before maturation, during, and after maturation, there will be burning pain and frequent urging with the scanty urine. The patient will be having a frequent urging, but the amount of urine will be so scanty. Often used when the bladder irritation is marked. Then great for acute symptom control. Okay, it is an acute remedy usually prescribed for UTI. Next is sarsaparilla. Sarsaparilla, pain towards the end of maturation. White, gritty sand in the urine. Features include burning and spasmodic pain. Next one important medicine is Calcarea renalis. Okay, it is usually given in 30 or 200 potency. It is one of the important medicine for renal calculi. It can be given as a specific. Okay, regarding the sites or the symptoms, it is one of the important medicine for renal calculi. Calcarea renalis is indicated specifically for the presence of renal calculi, especially those of calcium or uric acid type, and accompanying with the symptoms like pain during urination and frequent urging to urination along with the formation of gravel. Then some rare used remedies include Pararia brevia. Pararia brevia, one important symptom of Pararia brevia is the patient has to stand with the legs wide apart and also touching the legs, touching the head on the floor. This is one of the important symptom of Pararia. Intense urging and inability to urinate, strain suited for urethral involvement. Next one is cannabis sativa, spasmodic obstruction with urinary infection and high fever. Next, colocynth, crampy colicky pain that is relieved by bending double. Macphos, spasmodic colic with pain from warmth and pressure. And hydrangea is one of the traditional medicine used for renal calculi. Then asparagus, colic with blood and strong smelling burning urine. Bryophyllum, when the stone is very large. Bryophyllum is an excellent medicine. Then ipomia, it is severe cutting pain down the ureter along with the nausea. Then Ergerium aquaticum, there is a tenesmus of bladder with a frequent maturation. Then heroderma, the burning, irritation at the bladder neck with a frequent urging. Then prunus, mainly cramp-like pain in the bladder area with the tenesmus. So these are some important medicine for renal calculi. Just we can go each one of them. That is Berberis vulgaris, as I already mentioned, is one of the important medicine for renal calculi. There is a burning, numbness, lameness, and also the left side affection will be there. Then bubbling sensation in the region will be there. It is one of the important medicine for radiating type of pain. Then lycopodium, there is a red sand in urine. Along the right side affection will be there. It can be used as an intercurrent also. Then hydrangea is also known as a stone cutter. There is a white or sandy deposit and frequent urging to urinate with the burning. Then Gandharis, there will be intense burning pain, then frequent urging to urinate and often used in bladder irritation. Salsify, there is pain towards the end of maturation. There is a sand in urine and also burning spasmodic pain will be there. Calcarea relanis is one of the excellent remedy. It is a specific remedy for renal calculi. Next, rarely used medicine include pararia brevia. There is a intense urging and inability to urinate, straining, and is suited in urethral involvement. Cannabis sativa, spasmodic obstruction with the urinary infection and a higher fever. Next is colocin, that is cramp will be there, colic relieved by bending double. Maphos, spasmodic renal colic with the relieved from warmth or pressure. Hydrangea is a traditionally indicated for dissolving stones. Then asparagus, there will be colic with the bloody urine and a strong smelling urine. Brophyllum, when they suggested when the size of the stone is very large. Epomia, where severe pain cutting down towards the ureter with the nausea. Then Ergerium aquaticum, there's a tenesmus of the bladder with a frequent maturation. Eoderma, burning irritation at the bladder neck with a frequent urgency. Then prunus, mainly crampy pain in the bladder area with the tenesmus. So these are some combination products. Different doctors treat differently. Okay. So some will be using high potency medicine, some will be using only low potency medicine, some will be using only tinctures, and some will be using only combination medicine. So this is homeopathy. We just treat according to the symptoms, and also we have to get a maximum improvement within the stipulated time. That is the reason. Otherwise, the patient will be saying homeopathy is very slow. They always check for the result. They are always waiting for the result. Okay. So the patent homeopathic medicines include Similia redstone is one of the medicine. Then for Dr. Rugberg, number 27. Then Wellstone drops, Schwabe, and Baxim Clearstone. These are the patent products. So moving on to the main topic, that is the action of homeopathic medicine, hydrangea. So the full name hydrangea is Hydrangea arborescens. So traditionally, hydrangea is used as a stone cutter. Okay. The common name is seven bark, and it is the traditional use also. It is a stone breaker. It is commonly used for renal calculi, dysuria, and a gravel deposit. So, for a medicine to be called as a having a urolithic action, it has to be proven clinically, scientifically, and also with the phytochemical aspect. So, the hydrangea medicine, as in vitro, it has inhibition of calcium oxalate crystallization. Okay. Hydrangea shows inhibition of calcium oxalate crystal nucleation and aggregation in vitro, suggesting the capacity to reduce the stone formation. So when the medicine study is carried out with 30 potency, it shows the urolithic action. The tinctures of hydrangea exhibit maximum significance of dissolution of calcium oxalate crystals, mainly by the new technique. There are many techniques available. So one technique include the molecular docking analysis. So molecular docking analysis is mainly done to find the plant constituent content, which plant constituent content is acting more. So in the molecular docking analysis, with the phytochemical constituents, that is the main constituents like the curcumin and the camphor. These are the main flavonoids present in the hydrangea. This component has a very good anti-urolithic action. This for the renal calculi. It's a phytochemical study. So for each and every plant medicine, there is a phytochemical component or the main component which is responsible for the ultimate property of the medicine. So the main components like hydrangean, saponin, flavonoids, phytosteroids, volatile oil, resins, tannins, and other bioactive molecules will be present. So this also will be very useful for treating renal calculi. Next is the urolithic study of hydrangea. So the urolithic study, there are many publications regarding the urolithic study. So the hydrangea is supposed to get some and calcium oxalate dilution test. Okay. So the hydrangea has undergone various studies in laboratory, both in vitro and in vivo, and also scientifically. And for the urolithic action, by how the medicine is going to get the urolithic action, thereby reduction in the crystal size, inhibition of the crystal aggregation, and the increased crystal dilution rate. Next, kidney protective model. In many animal models, okay, animal models are usually carried out to get the deep pathology behind it, and also so much ethical consideration and ethical clearance are needed for animal study. So animal models show the hydrangea compounds reduces the renal tubular epithelial injury, calcium oxalate deposition, and inflammatory markers like interleukin 6, tumor necrosis factor alpha, and oxidative biomarker stress. Next is the diuretic efficiency. Diuretic means increase the urine flow. The hydrangea formulations and the main combination of hydrangea has to improve the urine volume, urine pH, creatinine level, and also reduce the oxalate and the uric acid. So this is the scientific study regarding hydrangea for renal calculi. So hydrangea, it is also known as the white. It is a shrub. It is also known as the seven barks, and it is traditionally used for renal calculi, dysuria, and renal gravel deposit. So first one is it has a action inhibition of the calcium oxalate crystallization. One of the most important action regarding hydrangea is it has inhibition of the calcium oxalate crystallization, and hydrangea shows inhibition of calcium oxalate crystallization in vitro. Okay, using different potencies, and also the 30 potency shows the maximum efficacy. Next, the tinctures is also very important, and also molecular docking will after molecular docking, the studies provide that the largest component present is flavonoids, mainly the crocetine and the scamperol. Then the phytochemical study mainly include the different components. Okay, mainly hydrogen, saponin, flavonoids, phytosterols, volatile oil, renin, and acid. So the urolithic action is studied in vitro, in vivo, and also in animal study. So also specific homeopathic potencies, there is different according to different potencies, and also different types of medicine, different studies are also available. And calcium oxide dilution test, hydrangea effect, it has a very important effect by reducing the size of the crystal and the crystal aggregation and increasing the crystal solution rate. Then many kidney protective models are available. Then diuretic efficacy, mainly by increasing the volume, pH, citrate level. So this is a case study. There's a 21-year-old male came to the OPD on 3/9/2025, and the complaint of the patient was he was having renal calculi and frequent urging to urination. Actually, he was working in abroad. He had come to the native for treatment of renal calculi, and he was initially under allopathic medication, and after that, someone says there is a homeopathy medicine available for renal calculi. So they come to OPD and also start eating the medicine. Homeopathy medicine hydrangea was given. It was given 10 drops 3 times a day for 2 months, and the patient was symptomatically better. And along with that, one kidney there was a hydronephrosis, and that complaints also totally removed. This is the picture before treatment that you can see. So there's a right vesico-ureteric calculi along with the resultant mild hydronephrosis is there in this first scan report. And after hydrangea medicine, this is a scan report. There is a no sonologically abnormality is detected and everything is normal. So I thank each and everyone for giving me an opportunity to present. So this is a short case regarding renal calculi. Thank you. Thank you all.
Thank you, ma'am, for a nice and knowledgeable presentation about urolithiasis. And ma'am, I have a question where we have to go lithotripsy, matlab at what size of kidney stone? As we know during our BHMS days, till 6 mm we can break through homeopathy. What is your view about this?
Ma'am, actually, the size of stone also matters. Okay, more than 6 mm, and also check whether
Hmm.
the hydronephrosis is present. In some case, the size of the stone will be very less, and also there will be severe hydronephrosis bilaterally. Okay, in that
Oh,
case, we have no other option than we have to treat. We have to treat for 1 month, then check for another scan. In that scan also there is a pathology still there. We
hmm.
don't we have we do not take the patient as granted. Okay,
Oh,
the risk behind it and go behind. But mainly the chance of lithotripsy depend upon the size of the stone, and
hmm,
also in some cases the types of stone. Okay, I have already mentioned the different types of stones are there in the
yes.
types of stone, and also the position of the stone. Okay, where it
Okay.
is causing any obstruction, just like that.
Mm-hmm. Ma'am, if there is a tendency to having a stone every 6 months, like in UTI, so uh, you have to treat the cause first, na? That is UTI.
Yes, yes, madam. We have to treat the cause first, and also sometimes if the usually the female children when they are going to school properly, they will not be able to go to toilet frequently. Okay, this is one of the
Mm-hmm.
reason. Sometimes they will be going to the toilet on morning, and also after only when they come back in the evening, they will be going for the next time, like just like that. And also during periods, they will be not even some girls are shy even nowadays to go to outside toilet. So these are one of the triggering factors. And next one is the E. coli infection, and also other infection by the contaminated water source. Frequently by the
Mm-hmm.
frequent washing, when the water is so contaminated, it will also lead to the frequent urinary infections, and which is one of the
Okay.
trigger for the renal calculi.
Okay, okay, okay. Ma'am, there is a question in chat box by Dr. MD Baul. He's asking short list of total medicine with potency.
What, madam?
Ma'am, can you open your chat box? Ma'am? There is a question. Please shortlist of total medicine with potency.
I have given this case. In this case,
Okay, 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 ma'am.
for this case, I have given only hydrangea. Mother tincture was
Okay,
given 10 drops 3 times a day. It was given
okay,
continuously for 3 months.
okay, okay, okay. And ma'am, can you give the potency? Only hydrangea tincture you have prescribed, now?
Yes, ma'am. For this case, I have given only hydrangea tincture. But
Oh,
calcarea renalis is another excellent medicine. Calcarea
hmm.
renalis is 30 potency. It is a very good remedy.
Okay, okay, okay. Ma'am, can you share more cases or few more cases about kidney stone and
Uh, I have
so?
today. I have only made a PPT of one case. So I will be sharing further cases with further medicines on further webinars.
Okay, 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 okay,
So,
ma'am.
ma'am, this webinar is mainly focused upon because most of the time our system is criticized because of we are not able to say what our medicine has action. Our medicine,
Hmm,
when given, the stone will be H helper. But what is the
hmm,
action? So, how this medicine is having a urolithic action? So there are
hmm,
many studies regarding the in vitro, that is the in vitro in
hmm,
the clinical situation, and also the in vivo studies are also there, along with the
hmm, hmm.
phytochemical studies are there. So this will
Okay.
be providing a very important base for our showing our scientific.
Hmm, hmm, hmm. And ma'am, you have told about genetic, that is 16 stones. Have you ever seen these type of cases of 16 stones?
Ma'am, I haven't seen any sustained type of stone till now.
Okay, ma'am.
It is
Mostly
also
the
interesting fact
mostly
that
stones are calcium oxalate only, na?
yes, ma'am, most of the cases are calcium oxalate. So one important thing is you have to advise the patient to pass urine outside. Okay, when and
Okay.
also when you in some cases I have got the renal calculi. They will be brought the calculi to the clinic, saying very happily, doctor, the stone has gone. So you have to
Okay.
just like old days we have stamp collection, coin collection like that. Just
Mm-hmm.
we have to make a new hobby of stone collection in renal calculi after the removal of stone. In allopathy, what they are doing is that after lithotripsy, when they are completely breaking the stone, they will take the stone and review the stone, which type of stone is there, and also they will treat the medicine accordingly. Okay, if sustained type of stone is there, they will treat accordingly. Uric acid type of stone is there, they will treat accordingly. We also are
Okay.
having the same type of treatment, but based on the symptomatic treatment.
Okay, ma'am. Okay. Ma'am, if there is acute symptom as a patient come having pain in loin, then you just prescribe hydrangea or first you give acute medicine, then
No, ma'am, in case of acute condition, in order to
hmm,
immediately subside the pain, I usually give chamomilla tennum along with the macrostennum alternately. That is 4 pills, 15 minutes alternately. That will be very
oh,
much helping reducing the pain. Okay. Our
oh,
ultimate aim is to reduce the suffering of the patient. So
hmm.
reduce the symptoms first and then the other approach of treatment.
Okay, ma'am. Thank you so much for your valuable information.
Thank you, madam.
And actually, we have 20 minutes more. If you can share something else about kidney stone or differential diagnosis about kidney stone, how we differentiate kidney stone pain to other pain like gallstone.
Okay, I will go by because I have only made a small presentation regarding. So I will
Okay.
go regarding that.
Okay.
1 minute only. So regarding therapeutics, we have already discussed, right? What
Okay.
are the factors regarding therapeutics? We have already discussed. Then,
Hello, ma'am. You can continue.
yes, ma'am. I'm good. So while regarding the investigation part, I will say a few points regarding investigation part. Okay. For in case of urinary tract infection for a female, and just don't collect the urine even during the periods time. Okay, during periods time there will be blood in urine and it will be lead to a misdiagnosis. And sometimes there will be, and also for urine collection, the mid sample urine collection we have to advise.
Hmm.
And also for urine collection and urine culture.
Hello, ma'am. You are not audible to us.
Area before when some it will also affect the result. So just
Okay.
before collecting the urine, we have to clean the area.
Okay.
Next thing is regarding X-ray and CT. Okay.
Hmm.
First thing is before one simple technique of finding whether it is a calculi or not, we have to go for X-rays. Okay. X-ray, when you are able to read X-ray, it will be well and good. But one thing is that in X-ray, the size of the calculi will not be measured. Okay. How much amount of stone will be, how many stone is there, or how, which is the size of the stone, or is
Hmm.
the stone is having any obstruction in between. This all types will not, this all causes will not be found in case of a X-ray. Okay. The most important thing is as it is when we are checking for the economy of the patient, that is, sometimes the patient will be very poor, okay, very poor
Mm-hmm.
regarding, and they consider homeopathic medicine as cheap and free of cost, and they will be coming to us, and if we charge or regarding the nature of the patient, also the economic status of the patient. For a scan, it usually cost about 900 plus. Okay, so sometimes
Okay.
they will not be able to afford such an amount. In that cases also, we are supposed to give a good type of treatment for the patient. Okay, in some cases, when you see, as I mentioned earlier, when there is a case of hydronephrosis or the complications which affect the kidney, in that cases, we have no other options. In some cases, we have to go for the CT. Okay, sometimes there will be the scapula-like appearance will be present. Sometimes it will be some case of a tumor just like that. Okay, we have to rule out. Otherwise, it will also lead to complication. Next one important condition as mentioned is hyperparathyroidism. Okay, hyperparathyroidism, it results in the increased calcium level in the body. Okay,
Yeah.
it is usually known as the disease of bone stones, psychic mounds, and abdominal groans. Okay, as we studied in our practice of medicine in the final year. So it is
Yeah.
also the important conditions which is causing it. Then gout. Gout mainly occurs due to the uric acid metabolism, that is the purine metabolism of the body. Then
Yes, sir.
there's a then there occurs there is a inadequate urinary drainage. Okay, the patient as mentioned earlier. Then one of the important complication is the Randall's plague. So Randall's plague is nothing like that. Mainly when occurs in when a renal stone is present, it will lead to the frequent ulcer formation in the particular region. Okay.
Okay, ma'am. Okay.
Main thing we have to check for is first prevention is better than cure. So just like that, drinking adequate amount of water and also passing the urine frequently. This will help to solve the problem to a maximum extent. Next, most important complication calculi affecting nowadays is because most of the persons are health conscious. Okay, they are taking rapidly. They are taking calcium and vitamin D supplements without the consultation of doctors.
Yes,
There,
ma'am.
there is something lacking in the body, and in order to provide to be healthy, they are unnecessarily taking the medicines, and which will lead to that is hypervitaminosis in the body or hyper calcium in the body. Okay, this are also ultimately the cause of the renal calculi.
Right, ma'am.
Then mainly we have to avoid food items like the spinach, then tomatoes, then the
Yes, ma'am.
asparagus,
And the
then
fruits and vegetables having seeds, na? Those
sweets.
having seeds, we have to avoid these things.
Avoid like that. Then also the small fishes. Okay, the small fishes like that. They are also having increased calcium content in the body.
Okay.
So, renal calculi is increasing nowadays in IT professionals because they are continuously sitting in a cold environment. The cold environment, they are continuously sitting and reducing water supply and also the overuse of junk foods. These are one of the factors. And the next is school children. They will not be drinking water much and taking water from the home in the water bottle and throwing the water outside the home and coming, saying that I have already drank the water. Just like that, they are usually saying. And when we are asking the mothers regarding this, the mother will be saying, "Oh, I am giving him or her about 1 to 2 bottles or 1 bottle of water, and when he reach home, he will be finishing it." But ultimate truth is the child will not be drinking water. Okay. Next one is urinary tract infection, and also the complication mainly hydronephrosis is the complication. Okay. Hydronephrosis, when occurs, there is a backflow of urine. Okay. When there occurs a backflow of urine, it also lead to hydronephrosis. And sometimes it will lead to other complications include pyonephritis. Pyonephritis means there will be frequent infection and also pus in the region. and ultimate
Hmm.
complication is renal failure. For a
Okay, okay.
person with the renal calculi, it is very good to check the RFT, that is a renal function test, at least once in a
Hmm.
month. Okay, we can check the status of the kidney function. Then one more, we have already mentioned in investigation about radiography that the plain KUB X-ray is found, and also the USG we have seen. Then RFT, renal function we have done. Then one important thing is the intravenous pylography or excretory urography. This is somewhat
Hmm.
costly. There's nothing more to do like that. But when we are supposed to go to a nephrologist, they will surely do this type of all the tests. Okay. Then
Okay.
the dietary advice we have to take advise the patient to drink adequate amount of water and advise to avoid the patient to eat spinach, strawberries, plums, and
Hmm.
small fishes like that. They have to avoid it. So
Okay, ma'am.
our medicines will be, and also one of the medicines which having action is tabacum. Okay, a tabacum there will be
Yes, ma'am.
violent
Tabacum is very good remedy, left-sided remedy.
tabacum with violent vomiting. There is one of important
Yeah.
medicine, and also osmum canum is there. In osmum
Yes,
canum,
ma'am.
there is a
Optimum
right
can.
side renal calculi is there. So don't
Hmm.
confuse with the osmum canum and osmum santum. So osmum santum is one of the remedy for respiratory complaints. Okay. Osmum
Okay.
canum. So C is one of the medicine, and the chamomilla and the colocynth and macos will be excellent in treating the pain. Okay. Then
Okay.
Pararia brevia has as I already mentioned, it has one of the important symptoms. The symptoms are usually been studied by us during our Viva time. Okay, when we enter the Materia Medica Viva, we will be frequently studying this type of important symptom. That is, can emit urine only when he goes on his knees, pressing the head firmly against the floor. Okay, that much of pressure is needed by the patient with the Pararia brevia. Then uh, it is a then Solidago. Solidago, it is a important thing is a Solidago is a homeopathic catheter. Okay. There will be scanning urine along with the dysuria. This is one of the important medicine. Then Uva ursi is one of the medicine for urinary tract infection. Uva ursi tincture is one of the important medicine for urinary tract infection. Then calcarea renalis, as I already mentioned, it is also one of the very good medicine. So
Okay.
we
Ma'am,
can
there are many medicines as we go with the patient now, patient symptoms and then repertoire. So we found many medicine according to the symptoms.
yes, ma'am. According to the symptoms, we have many medicines.
Yes,
Sometimes the
ma'am.
medicine which is not for renal calculi will also come.
Okay, 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 ma'am. Oh, and then, ma'am, how you related to the ma'am, if do you have any repertoire symptom or important rubric regarding kidney stone? Any peculiar
Urine,
symptoms?
madam, in our repertories, there is kidney urine sediment calculate. There is one rubric is there, and also in different repertories, different rubrics are also available for the renal calculate. So I usually check for the common symptoms taken by the patient. Common symptoms
Okay,
set by the patient and as in the for the constitutional remedy.
okay, okay, okay. Okay, ma'am. So, ma'am, in kidney stone, there is no importance to make constitution. In starting, we have to give according to the symptom and according to the size of the remedy. But if there is any tendency of genetic, like in cystine stone or Stuvite stone, then we have to go for constitution prescription.
A constitutional prescription will be very much effective because our
Hmm.
system is totally based on this. But in some case, we will
Yes.
not be able to get a constitutional
Hmm.
medicine, and only
Yeah.
in this case also this case The boy was working as a merchant navy, working in merchant navy, and the boy come suddenly to the native for this company. The ultimate aim of the boy was to rapidly get out of his complaint and go back to work. So
Okay, okay.
that case, we have to get an immediate relief to the patient.
Mm-hmm. Okay, okay, ma'am. Thank you so much, ma'am, for your presentation and for your information. And I'm Dr. Dhani, sir, if you can speak few words regarding this presentation.
I think Dhanesh doctor is not there, and as moderator, you should please listen about anybody, if anybody is raising the hand. That should be, and moreover, always it is better to open the camera as well as laptop for such presentations as well as moderation. Anyway, nice presentation for such cases. And you mentioned about the diet and regimen and general management of cases. Then they got the general management about the quality of drinking water. Do you have any suggestions there? Especially the water from the bore well may often cause this urolithiasis. Dr. Amrutha, what is your opinion? Am I audible, Dr. Amrutha?
Good evening, sir.
Please.
Good evening, sir.
Good evening. Yeah, please.
Sir, it is also one of the factors I have just forgotten to mention. And also quality of water is very much important. And also the borewell water, and also increase the calcium content, adding supplements in the water. It also triggers the formation of renal stones.
Definitely. In fact, what is intended for drinking purpose is the surface water. As we study in the park and park, it's mentioned always. Unfortunately, it was not available, and what happens is that people are using this borewell water. They often get such diseases, so the nephrocalcinosis, because of high calcium content. That regarding the dietary advice, what are the substances you have to avoid to avoid such problems? Dietary articles. Am I audible, Dr. Amrutha?
Hello, sir.
Diet and regimen management, the diet. What are the
Yes, sir.
substances?
The substance like the spinach, the nuts, the tea, frequent tea drinking also triggers the urinary stone conditions.
Then about the vegetables.
The spinach is one of the main important,
Yes,
and
that is
also
one of the best.
asparagus.
Yeah.
All the things will be causing it.
The yam.
Yeah.
Yeah. That will cause oxalic crystals. And they have done a wonderful study because this medicine, the hydrangea, can reduce the formation of this crystal, what the painful crystals, oxalic crystals. It's a good study. Congratulations for presentation as well as your endeavor to promote homeopathy through that track. Thank you.
Thank you, sir.
Thank you, ma'am, for the nice presentation. Still, we have 6 minutes left. As
Yes,
per
Dr. Rambarvesh is there. He's an experienced person. Sir, please.
Okay.
You can make your comments, sir. Definitely, please. I think they are very.
Thank you, Manoj ji. Everyone, good evening. Congratulations, Dr. Amrutha. Very nice presentation. Describe the kidney stone and nephrology. Very good remedy, lot of remedy. Describe the osimum, hydrangia, lycopodium, etc. A very good remedy. Kidney according to symptom and according to miasmatic, role of miasmatic. I give the patient medicine, tantric burning sensation and urgent urination and drop urination. Tantric sixth power is a very good remedy for kidney. and Andingia and Puja. One name, two dose weekly. Puja is a very good birth for the case of a kidney stone. So very, very thanks, Dr. Amrutha. Thank you.
There's a question in
Ma'am,
chat box. There's a question chat
yes.
box. Any specific remedy suggested for uric acid and gout symptoms, Dr. Amrutha? Any specific
that?
remedy suggested for uric acid and gout symptoms?
For uric acid, usually give with the benzoic acid and also lycopodium. It is also a good remedy along with the Berberis vulgaris tincture, uric acid stones.
Yes, good. Thank you.
Thank you, sir.
Attica urens, Attica urens Q is a very good remedy for uric acid.
Yes, words of experience and wisdom. Yes, Dr. Amrutha. Thank you. Now, Dr. Rajita, you can conclude now, please.
Okay, very, very congratulations to Dr. Amrutha Manohar for this nice presentation and very informative about kidney stones, as she told about 16 stones that are genetically found and steroid stone like found in UTI cases. And ma'am, can you tell about the miasm? I think miasmatic cause.
So miasm, mainly there is a stone aggregation is there. Mainly the disease comes with a sauropsychotic background. Okay, sauropsychotic background. And ultimately, when the bleeding and other complications occur, lead to syphilitic.
Okay, ma'am. Thank you so much.
Thank you so much, ma'am.
And if anyone has any question regarding this presentation, they can ask.
Dr. Rajita, don't worry, you can wind up now. No problem, Dr. Rajita, please.
Okay. Very congratulations to you, ma'am. And now we are handing over this session to Malayalam team. Still there is 1 minute left.